All right, let's see here. Get set up here real quick. So I nuked that last one. Get set up here. Yeah, nuked the last one. So to some of you, if you saw this, this is going to be regurgitated information, but I'm going to go through this again. A little bit of this stuff. Um, Hopefully it'll be a little quicker. Maybe I can get through a little more of this. But I'm going to say this to start off with, as far as a lot of stuff goes. Um, Marital status unknown. That's interesting. But I guess the time of this, they probably didn't have a lot of information. Um, and this is probably why. The FBI took them 2 months to fingerprint. Went over that a little bit on the last one. So I'm going to say this, man. For all you conspiracy junkies out there, there's something for you. Why would it take the FBI 2 months? And you think about that, these people didn't have a positive identification for 2 months on who this was. It's a little crazy. It's a little crazy. And if they're sitting here thinking that a guy named Stephen Paddock did all this, but they're not even sure this is the right guy for 2 months, that's a little crazy. The fingerprints were delivered with the body, I believe. It was part of the body bag stuff. So that's an issue. Why it took that long. Now I'm guessing, that the LVMPD, they can do fingerprints themselves. Obviously, I would think so. Oh yeah, and you're gonna hear some shit going off, man. It's 4th of July going tomorrow. Anyway, you would think, maybe the LVMPD actually did some fingerprinting. They figured it out already who this person was. Why this down here says FBI? I don't know, man. That's a little suspect. It's a little crazy. Why it took them 2 months to figure out who this person was. Anyways, so sympathetic. Date of birth, yeah, don't care. Date of death, I was born 53, so yeah, all right. So 53, he would have been. God, I did this math last night in my head. It's 71 would have been when he was 18. Should have been graduating high school. Um, I'll say this again. Truth Seeker did a props to her for doing that. She did a little interview with the guy who claims to have gone to school with this person. I did find the roster of that school. Of course, if you look online, you can find yearbook photos of this dude. I never matched up any of the other people in that yearbook photo to the school alumni. Someday, maybe we'll get around doing that. I just didn't care at the time. But I did not find Stephen Paddock going to that school in that year. So, in any of those years, leading up to that, couldn't find him anywhere in that. That guy she did the interview with also said that he had a best friend, William Nishiki, I believe, something of that nature. I don't remember. I got it written down somewhere. But couldn't find that guy either. Could not find that guy. I did find Peggy Okamoto, which is, his second wife, I guess, which is something the guy said in that little interview that he went to school with, one of Paddock's wives. That was the only thing I could corroborate with what he was saying. So there is a Stephen Smith there. So the only thing I can make out of that, or I could make out of that, is it's possible, since their father was on the most wanted list that time, whatever, in jail, whatever, and they moved, I'm guessing, to kind of get away from it. It's possible they changed the last name to Smith, which is pretty damn generic, just so they get away from the stigma of that. But not entirely sure. Funny thing is that Stephen Smith, on their alumni page, to what I saw, he was the only person with a personal message. So I'm wondering which of you guys got a hold of that information, ran over there, and left a message for him. Anyway, so here we go. Here we go with the autopsy of Paddock, round 2, because I've already gone through this, but I'm going to go through it again just because I nuked that video. Let's see. Reason for coroner jurisdiction. And for those of you who watch that to the end, you know why. Apparent suicide, intraoral gunshot wound, mass fatality incident, Federal Bureau of Investigations, FBI, Las Vegas Metropolitan Police Department. All right. So, per LVMPD investigation, decedent checked into suite on 32nd floor at Mandalay Bay Hotel. Again, this is something regurgitated information. We're going to hear this a couple times within this because I've already read through it. On 9/25 on 2017. On 9/29/2017, an adjoining room, which was accessed by connecting doors, was added. On the night of 10/1/2017, a Mandalay Bay security guard was assigned to check open door alarms from various rooms inside the hotel. Why that is relevant to an autopsy, I have no idea. Last room the security guard was assigned to check was on 32nd floor. However, he was unable to access the 32nd floor from inside the stairwell as the door would not open. I don't know why. This is all circumstance of his death, but unless Campos had something to do with this thing starting, this really should not have any place in the circumstance of his death, I would think. After gaining entry on 32nd floor from the guest elevator, security guard noticed an L bracket in place on the stairwell door that was preventing the door from opening. After the security guard called the Mandalay Bay Dispatch Center to report his findings, he heard apparent rapid drill noises coming from room 32135. He then started walking back down the hallway, at which time he heard apparent gunfire and realized he was hit in the leg. He called for help. Again, why all this is relevant to the circumstances of Paddock's death, I don't get it. The decedent then continued to fire multiple shots out of his hotel windows with numerous rifles into the music festival venue, striking people at the concert. Now, this I can kind of understand. LVMPD SWAT responded to the decedent's room and entered using an explosive breach. Upon entry, the decedent was found beyond medical resuscitative measures on the floor with apparent self-inflicted gunshot wound. Now, the way that is written is pretty suspect. I mean, not too sure why they would put he was beyond resuscitative measures at the time of the breach, because, I mean, why didn't they just say that the dude was apparently deceased at the time of the breach? But, whatever. Still flopping around, little chicken with the head cut off action going on there, legs kicking, shit like that. I don't know. SWAT continued to clear the room, breached the door to room 32134. Actually, I doubt it. I doubt all that. This was quite a while after. While breaching the door, an unintentional 3-round burst. Why this is relevant at all to this guy's death, I have no idea. 3 rounds rapidly at once was shot. Shot was fired by a SWAT officer. All 3 impacts were located, and the decedent was not struck by the unintentional rounds. Upon my arrival, I pronounced death on the scene 12 o'clock on 10/2. It took him a while to get there. That's another thing that's kind of a weird thing here. But yeah, that I don't know why that has anything to do. This 3-round burst has anything to do whatsoever with this dude, how he died, and the coroner. I don't know. Decedent's medical history was unknown time of his report. There was 1 prescription bottle containing pills and 2 inhalers located in the decedent's room. None of the prescription medication was impounded none of the prescription medications were impounded, as the FBI and LVMPD were still actively processing the scene. Okay, so they didn't give him any of the medication, any of that shit. You would think at least they would write down what they were. I kind of want to know what the inhalers are, even though Could be asthma, could be nothing. I still would like to know. Decedent was found lying supine on 32nd floor of room 32135, Mandalay Bay Hotel Casino, and who cares where the address is? There were double entrance doors to the room. One of the doors was damaged and off the hinges. There were multiple holes and defects noted to the door that was off the hinges. The other door, an apparent camera taped where the peephole would normally be. There were multiple rifles, expended cartridge casings located throughout the room. There was a Smith & Wesson 38 caliber revolver bearing serial number, who cares, found near the decedent. There was a broken window in both rooms. The windows in the rooms were from floor to ceiling. Why did I just lose my place? The two broken windows were nearly completely shattered, which I think is interpretation. There were multiple different drills and tools located in the room. Outside the room, in the hallway, was a room service cart. There were plates on the cart, and under a plate was a camera. There was another camera on the cart on the bottom shelf. The cart was positioned in the hallway outside of his door. So the cameras were pointing down the hallway. There were numerous apparent impacts present in the hallway. There was no apparent suicide notes located, except for the unplugged phones. Guess that was the suicide note. The decedent, 64-year-old Caucasian male, was observed lying supine on the carpeted flooring in his hotel room. A limited examination was conducted. He was clothed in tan shirt, black shorts, or black gloves, black pants, underwear, white socks, gray shoes. The gloves were impounded by the FBI, which is weird. I don't know why the FBI was so interested in just the gloves. I guess for bullet residue, stuff like that. Possibly. The gloves were impounded by the FBI. Upon palpation of the head and skull, crepitus was noted. There was an apparent intraoral wound noted. There was apparent blood-like substance noted about the face and head. The neck, chest, abdomen, back, and extremities appeared to be unremarkable. There was blanching posterior livor fucking mortis noted, which was consistent with the position the body was observed in. The body was cool to touch. Rigor mortis was noted. There were no signs of life present. I pronounced death at, who cares? That was a long time, though, man, to pronounce death. We'll find out later why. Property per county, Clark County office, the coroner, the coroner. Inventory of personal effects from no property was impounded. Okay. I guess clothes don't count as property in this case. That's what it looks like. Whatever. So yeah, I guess if it's connected to the body, maybe it's not considered property to them. I don't know. Forensic issues and reasons for seal. Coroner seal utilized. Apparent seal number. I don't know. Maybe that's got something later as far as following seal numbers. I don't know if these things changed or not. Never really checked on that. And most of this is brand new territory for me because I've never gone into Paddock's autopsy. Never really cared. Apparent intraoral gunshot wound. Weapon believed used for self-inflicted wound, impounded by the FBI. Smith & Wesson 38 caliber revolver, bearing serial number. Who cares? No ammunition information was available at this time, as FBI and LVMPD were still processing the scene. Decedent was wearing black gloves, impounded by the FBI at scenes. His hands were bagged. Yeah, I guess I don't know. That might be a normal thing. There were numerous rifles along with the revolver found in the room. No suicide note was found. Decedent's vehicle is located in the parking garage with explosive device material impounded by the FBI. Witness and information sources. So this is where he got all this stuff from. Was also Padden, crime scene analyst personnel, which is a little vague. But yeah, whatever. Narrative. That's funny. They actually use that. On 10/2/17, approximately 11:15, LVMPD advised this office of a death located in room 32135. Now, took them a while to actually call the coroner and say, we got a body for you to pick up. The coroner's office. I think they would work hand in hand, but apparently not. Of the Mandalay Bay Hotel Casino located at, who cares? Upon my arrival to the Mandalay Bay Hotel and Casino at approximately 11:35, so it took about 20 minutes to get there, I met with LVMPD Force Investigation Team Detective T. Alsop and Jay Patton, who provided me with the aforementioned circumstances. They stated that this was reference LVMPD event number, who cares, and the initial 911 call came in at 10:08. He stated that LVMPD radio traffic regarding shots being fired initially started at 10:05. They requested that the decedent remain on the scene as FBI was responding, but they expected that to be several hours before their arrival. The decedent remained on scene until FBI and LVPD was ready for the removal of the body. Approximately 9 o'clock at night. Man, this guy sat around till 9 o'clock at night waiting for them to let him take the body. So 9 hours, shit. Man, they couldn't just take pictures of the body, do their thing around the body, do their investigation, say, hey, take this thing out of here, and then deal with all the rest of the shit. Nah, they made this fucking guy just wait. They didn't give a shit about this guy's time. LVMPD dispatch advised this office that they were ready for the removal of the decedent from the scene. Investigator S. Shields responded along with David's funeral home. Okay, so the guy left. Dude came and did this report. Said, well, fuck you. Call me when you're ready. Let's see. The decedent was wrapped in a clean white sheet, placed in a body bag that was sealed with coroner seal. Yeah, who cares? And transported to Clark County office. Arriving at approximately 9:50. All right, so it took them 50 hours to wrap this thing up and get it down there. Special request, non-tissue organ donation, Nevada Donor Network protocol follow. Yeah, I don't think you'd be donating this guy's organs. I doubt it. Okay, so this mess, man. Intraoral gunshot wound to the head, contact range, entrance, roof of mouth with abundant suit. Associated injuries. Now we're gonna get into some big fucking words here that I don't even want to deal with. Perforation of the roof of the mouth, base of the skull with internal beveling, and the brainstem, the cerebellum, the left occipital lobe, which is his left eye. That's why his left eye is bulging out, and partially into the occipital bone. Now that is the ear, the inner ear, the bone that attached to the inner ear. So that would cause, but this is the left side. Last night I was kind of going off about this. This explains why the detached ear and all that bullshit is supposedly a thing. Subdural hemorrhage and subarachnoid hemorrhage, contusions along the wound track and of the base of the brain, fractures of the supraorbital portions of the frontal bones, base of the skull, the left petrous bone and occipital bone, bilateral paraorbital soft tissue hemorrhage. Fun stuff, man. Sounds like a party. Let's see. Recovered. Moderately deformed copper jacketed gray metal missile. And fragments of copper jacket and gray metal between occipital dura and partly into occipital skull. Exit. No corresponding exit. Trajectory front to back and upward. Hypertensive cardiovascular disease. Yeah. Let's see. Hypertensive vasculopathy and atherosclerosis per neuropathy. Consultation. At least I'm a little more awake trying to read this shit. Globally sclerosed glomeruli, glomerulomegaly per histology, slightly increased perivascular fibrosis and scattered hypertrophied myocytes per histology. Fun times. looked some of this crap up last night. I mean, there's nothing really crazy here yet. Blunt force injuries to the extremities. This is kind of interesting. Abrasions to the right upper calf, faint contusion of the left calf. So contusion, I believe, is just a bruise. So both calves. I don't know. He had a gun underneath them. I don't know. Was kicking a little bit, beating up on that gun. Although that seems like it's the upper part of his leg in the photo. Who knows where it was originally? Abrasion to the right knee. Not sure what that was. Right knee. Could have been crouching down while firing at some point. Maybe he had a little bit of glass action going on there or something of that nature. Maybe some shells. He was on a carpet of shells. Not too sure. Overweight. Dilated cardiomegaly. Whatever. Degenerative changes to the spine. So there's the height problem right there. That explains why the height is an issue. Diverticula. Mild degenerative changes to the mitral valve, and appendectomy. All right, so here's your appendix. His appendix were removed. That's what that means right there, man. His appendix were removed. So the whole idea with scars, they're admitting right here that the appendix were removed. So the fact that there's no scars to me is fucking stupid and pointless. Or the fact that they didn't mention them is absolutely pointless, because this right here, you have to take into account that since this guy had his appendix removed, that those scars did exist at some point. Whether they existed at the time of this or not doesn't really matter. They're admitting his appendix are gone. They didn't pull him out through his fucking throat, so those appendix are gone. Cause of death: 64-year-old man, Stephen Craig Paddock, died of an internal gunshot wound to the head. Suicide. Lisa Gavin. All right. 2-5. 2018. So why 2018? Why was this put on the shelf till 2018? I think the body was fucking well gone and fucking toasted by then, man. I thought they threw this guy in a toaster pretty quick afterwards. And the FBI they took their own damn sweet time. It took them 2 months. It took her 2 months to finish out this. That's kind of crazy. That's a little strange. But then they were sending brain parts and stupid shit all over the place. So who knows? An autopsy examination is performed on the body tentatively identified as Paddock. There's no date on this. October 6th. Okay, so this is October 6th. Stephen Craig at the Clark County office, the coroner medical examiner, on 6th day of October 2017, commencing at 4:22. Identification is later confirmed by fingerprint comparison. The body is received within a sealed body bag. That looks like the same number to me. It ended in 86, which is opened on 10/6/2017 at 4:25 by 4:21. So they don't want to use names here, I guess. The body is identified by Clark County office of the coroner medical examiner, toe tag around the great right toe, which includes, this toe tag was just who they think it was. Because at this point, if they haven't done the fingerprints, and they're even admitting up here, tentative body is identified. I believe it said tentative up here somewhere. Tentatively identified as Paddock. Yeah. Okay, so someone put that toe tag on. Well, the guy who went into the room, I guess, put the toe tag on, but he was told it was Paddock. That's why it says Paddock, I guess. around the great right toe, which includes the case number, name Stephen Paddock, date of death 10/2/17, time of death 12 noon, hours, yeah, who cares? Um, Coroner investigator number 342. Find out above who that actually is. The autopsy, actually, it's Lisa Gavin chick. The autopsy is conducted in the presence of Detective Alsop and Detective Cullen, crime scene analyst Fletcher of the Las Vegas Metropolitan Police Department, also present Special Agent R.H. Marriott and Special Agent G. Kwan of the Federal Bureau of Investigation. So FBI was interested in this. External examination, including injuries. The body is that of a well developed, overweight white adult male who weighs approximately 224 pounds. This is 73 inches in length. Yeah. And again, beauty at all sizes, I guess. The body is received clad in a brown long sleeve shirt, black pants, blue boxers, two white black socks, and which they were white earlier, but now they're black. But I think that's because the soles have probably got some black in them. Couldn't see them under the shoes till now. And two charcoal shoes. Of note, during processing, a brass-like casing adjacent to the head is found. So, everyone made a big fucking, there were a bunch of people making a stink about this casing. Who gives a shit, right? This guy's bleeding all over the place, laying in a carpet of fucking shells. Yeah, something could have got stuck in the globules of blood that was, hardening around his head and just made the trip. Kind of was a stowaway in the body bag. So I don't see that as being an issue. The body is cold, refrigerated. Rigor mortis is receding. Fixed pink livor mortis extends over the posterior surface of the body. Evidence of post-mortem change includes green discoloration of the right lower quadrant of the abdomen. Yeah, there's a party going on inside. Scalp hair is gray-white, straight, and short with male pattern baldness, as opposed to female pattern baldness. He had the male kind. The irides appear lighter in color. The pupils are round. Okay. The corneas are clouded. Whatever this take noir is present of the sclera, which are otherwise injected and focally hemorrhagic. All right, so he's hemorrhaging in the eyes. The conjunctivae are a mixture of pale and congested. So, lighter in color. Yeah, because of all this shit going on. Whatever. Doesn't say the color, though. Nose and ears appear, I think it said above, though. Nose and ears appear normally formed. Normally formed? They're not detached. In the right ear is white tissue paper. In the left ear is bloody tissue paper. Decedent wears an unkempt beard. All right. The anterior teeth are in poor condition, with the majority of the ancillary teeth being absent. So the maxillary teeth. So, gun knocked out his teeth, a bunch of his fucking teeth. The other chick was saying that one of the witness statements, I believe, is his aunt, saying he had his teeth were in bad shape. So, yeah, not sure if that's what they're talking about or just the gun fucking cracked a bunch of teeth. The neck is unremarkable. Thorax is well developed. The abdomen is flat, as opposed to a remarkable neck. The anus contains hemorrhoids. Woo! Yeah, party going on. The spine is normally formed. Surface of the back is remarkable for nevi. That's warts or whatever. Moles. So, I guess moles make you remarkable. The external genitalia are those of a normal adult male, with the testes descended bilaterally into the normally rugated scrotum. I'm not gonna fucking look that shit up, and I'm not going to go into that. That's on you. You can do your own research on that. Page 3. Let's see. The upper and lower extremities appear well developed and without absence of digits. Some pitting edema is noted on the lower legs, particularly in the sock-like distribution. Okay, so I believe edema is where your skin loses pigmentation. Identifying marks and scars. On the mid left or left mid aspect of the back is a 1 inch brown macule, a 3/8 inch light brown macule on the right. Yeah, don't care. Ventral arm near the elbow is identified. I guess if we could actually find other pictures of him somewhere, this would be some identifiers. Let's see. There's no evidence of medical intervention. Yeah, I mean, and of course, that means that doesn't mean he never had his appendix removed. Oh my God, no! This means, at the time of the injury or the death, I guess. Let's see, intraoral gunshot wound to the head. Entrance on the roof of the mouth, center approximately 6.5 inches below the top of the head. And 1/4 inch to the left of the anterior midline is an entrance gunshot wound consisting of a 1/2 by 5/8 inch defect with a marginal abrasion that appears widest at the 6 o'clock position, 1/4 inch. Abundant suit is present within the roof of the mouth. Associated injuries: perforation of the mouth, roof of the mouth, the base of the skull, the brainstem, cerebellum, left occipital lobe, and partially into the occipital bone with external beveling. So we're talking about the left occipital bone here, which would jack up the left ear. I believe the right ear is the one everyone has problems with, trying to say that it's detached, but talk about that in a minute. Is seen with contusions of the brain along the wound track. Contusions of the base of the brain are seen along the brain with brain swelling, right? So you got some swelling going on. Fractures of the supraorbital portions of the frontal bones, the left petrous bone, and the base of the skull and the bilateral occipital bones are seen. Subdural hemorrhage and the subarachnoid hemorrhage are present. Bilateral paraorbital soft tissue hemorrage is noted. All right, so he's hemorrhaging like crazy. He's bleeding inside of his fucking skull. So there's a lot of that going on. And there's also some swelling going on, brain swelling going on. All right. So we got that. So deal is, as far as that ear goes, we see swelling going on in the head. We also see some hemorrhaging, which I think would cause swelling as well. That blood is not meant to be there, apparently. That's why it's got this word. So, when it comes to that detached earlobe, there is no. That photo is not good enough. It's not a good enough photo to determine 100% that thing is detached. Never was. And that's kind of the argument that I would pose to that. Hey, what's up? What's happening? That's the argument I would pose to that. Is you have a lot of swelling going on here, head's blowing up like a softball, and at that point you're going to see all kinds of crazy shit happen to to things like earlobes, that are soft tissue. So as far as that goes, I don't buy it. I'm not buying that. The eye color above was similar, so I'm not buying that either. The they admitted they said on this thing, which I think is where everyone got that from, his appendix been removed. And so down below here, we're going to get to where it's going to talk about his scars and stuff like that. And it's not going to say anything about those appendix being removed or a scar for the appendix being removed. But unless you think there's a crazy way to take the appendix out, like through your throat or something like that, and you have proof that this guy actually got him cut out of him, it's a stupid fucking argument. It's a dumb argument. Otherwise, if they're trying to hide that, and this guy didn't actually have his appendix removed, they wouldn't have put that in the report. Anyway, that's dumb. Anyway, moving on. Recovered between the occipital dura and the occipital skulls, moderately deformed copper jacketed gray missile. Love that. I love how they call it that. Additionally, minute jacket and missile fragments are recovered in the same location. There is no exit wound. The wound track travels from decedent's front to back and upward. Okay. Let's see. Blunt force injuries of extremities on the right upper calf is a 1/2 by a 1/4 inch red brown abrasion. All right, scraped his calves. On left calf is a by 3, so it's pretty close. Well, a 1/4 inch by 3/16 inch faint pink contusion. Faint. Okay, so it's happened right before the death. Didn't have enough time to get some blood flowing through it to cause a bruise, possibly. Not sure. On the right knee is a 1/4 inch by 1/8 inch red abrasion. All right. So again, knee, who knows? 1/4 inch, not very big. He could have put his knee in anything at that point. Body cavities, focal adhesions are present between the loops of bowel. I'm not looking that up. All body organs are normal and anatomic position with apparent surgical absence of the appendix. Right there, you go. Appendix removed. I don't know what the problem is with that. The serosal surfaces are glistening. Whatever that means. I don't care to look that up. Let's see. Apparent surgical absence. Yeah, that's it. It's just his appendix removed. The brain weighs, yeah, who cares? And is swollen. Yeah, obviously. The dura mater and phallic cerebri are not adherent to the brain. The cerebral hemispheres are asymmetrical due to injury. The injured structures at the base of the brain are free of abnormality. Sections through the uninjured cerebral hemispheres reveal no lesions within the cortex, subcortical white matter, or deep, parenchyma of either hemisphere. Let's see. Sections through the uninjured brain stem and cerebellum reveal no lesions. The spinal cord is not removed. Sections of the brain are submitted for further forensic neuropathological evaluation. All right. Neck. Examination of soft tissues of the neck, including strap muscles and large vessels, reveals no abnormalities. The hyoid bone and larynx are intact. The tongue is normal. The heart weighs, yeah, who cares, and is dilated. The pericardial sac is free of significant fluid or adhesions. The pericardial surfaces are glistening. The coronary arteries rise normally and follow the distribution of the right dominant pattern with no significant atherosclerosis. The chambers and valves are proportionate. Mild degenerative changes are present in the mitral valve. The remaining valves, all cusps are normally formed, thin and pliable, and free of vegetations and degenerative changes. God, how would you like to have this fucking job? Fuck this. This person probably is in permanent debt for taking classes for this too, man. It's crazy. Focal area of pallor is noted in the lateral left ventricle. Let's see, near the base of the heart. The atrial and ventricle septa are intact. The tricuspid valve measures, yeah, who cares? The mitral valve measures, doesn't care. Pulmonary, yeah, don't care. Don't care with the aortic valve. The right ventricle, don't care. Whatever. The aorta. God, I just made up a word. Should be proud of that. The aorta and its major branches rise normally and follow the usual course with no significant atherosclerosis. The orifices of the major aortic vascular branches are patent. This is all like Japanese to me, man. The vena cava and its major tributaries are patent and return to the heart in the usual distribution are unremarkable. Let's see, respiratory system. The right and left lungs wave, whatever, respectively. The upper and lower airways are unobstructed. The mucosal surfaces are smooth and yellow tan. The pleural surfaces are glistening. The pulmonary parenchyma is a dark red purple in the dependent portions and lighter pink in the anterior portions. The cut surface exudes moderate amounts of blood, particularly in the dependent portions. The pulmonary arteries are normally developed and without thrombiol, throm, throm, thromboemboli, and atherosis. Whatever. Be your dictionary word of the day, man. Say that 5 times in sentences throughout the day. That'd be fun. There is no saddle. All these fucking words. Embolus on the in situ examination of the pulmonary trunk. So sounds like homeboy didn't smoke. Doesn't sound like a smoker to me. I mean, unless there's something there that explains that. I don't fucking know. Liver and bilateral, yeah, fuck, man. Liver ways, yeah, who cares? The hepatic capsule is smooth, glistening, and intact, covering brown, slightly fatty parenchyma. The gallbladder contains a moderate amount of brown tan liquid bile without stones. I still has a gallbladder. That's cool. Some cholesterolosis is noted of the gallbladder mucosa. Alimentary tract. The esophagus is lined by gray, smooth mucosa. The gastric mucosa contains the usual rugal fluids. The lumen contains approximately 50 milliliters brown liquid. The serosa of the small bowel is unremarkable. Why did they just say also is unremarkable? What the fuck? Save me a lot of time here. The serosa of the large bowel is remarkable for diverticula. The small bowel contains some partially digested food. Oh, man. The large bowel contains a mixture of softened and semi-firm stool. Nice. Diverticula are intact and present, particularly in the sigmoid colon. The appendix is surgically absent. The pancreas contains fatty infiltration. That's a nice word for that. Infiltration of the pancreas. Let's see. Whatever the fuck that is. Genitourinary tract? Yeah, I guess. The right and left kidneys weigh, whatever. The renal capsules are opaque strip with difficulty from underlying granular, scarred, and brown. What? The renal capsules are opaque strip with difficulty from underlying granular, scarred, and brown. Cortical surfaces. The cortices are of normal thickness and delineated from the medullary pyramids. It sounds like something in Egypt. The calyces and pelvis are dilated but free from stones. Urinary bladder contains a moderate amount of yellow urine. The mucosa is gray tan and smooth. The prostate is not enlarged. The testes are unremarkable. Oh, shit. Whatever that fucking word is. Reticulum dothelial? Reticulum dothelial system. Okay. Spleen weighs, I'm going to say that fucking 5 times straight. 5 tons fast. That's crazy. Spleen weighs 140 grams. I don't care. And has an intact capsule covering a purple diffluent parenchyma. The splenic white pulp is indiscernible. The bone marrow rib is red purple. There is no prominent lymphadenum. Whatever. Fuck. The thymus is dispersed in the anterior mediastinal fat. Endocrine system. The pituitary gland is a large size. The thyroid gland is of normal position, large size, and normal texture. adrenal glands have yellow cortex and the otolizing gray medulla. Jesus, man. The fuck? Musculoskeletal. I'm like taking a course here in garbage. Degenerative changes are present in the spine. The soft tissues are not unusual. Um, the cervical spinal column is stable on internal palpitation. Don't see any slip discs, anything like that. So the tissue's not unusual. Tells me he didn't really have a bad back. He healed from whatever that was, that fall that he had at the Wynn. Degenerative changes are present in the spine. So his spine was degenerating, which, okay, he shortened a little bit from that. Let's see, microscopic conductive systems, AV network of muscle fibers, and whatever, dude. Heart, increased fatty infiltration, hearts, septum, scattered hypertrophied myocytes, ganglion cells, and nerve fibers identified. Half of this shit I didn't even know was in the human body, man. It's crazy. Heart, scattered, minimally, don't know what this even means. Myocyte disarray, autolysis, the lung, right lung, left lung, autolysis, patchy areas of. Oh, what the hell does that mean? Oh my god, I'm actually gonna look that up because I'm curious if this guy smoked. Let's see, what is this? Atyl. How's this spelled? Oops. Wait, where is this thing? Wait, let me do it on this one. Atyl something or other. Let's see. Looking at the lungs. Atelectasis. Atelectasis. Let's see what this means. Is complete or partial collapse of the entire lung. Okay, so this lung collapsed, or he had a partial lung collapse. It occurs when the tiny air sacs within the lung become deflated or possibly filled with fluid. Most common breathing complications after surgery. Patchy areas, huh? Well, he was breathing in some blood, I guess, or shit. I don't know. I don't know if that has if that's what that's from. Let's see, mild diffuse. What is this? Autolysis. Autolysis. The destruction of cells or tissues by their own enzymes. Okay. Especially those released by, yeah, okay. Whatever. Not worried about it. Let's see, liver, mild diffuse, whatever, portal tracts without increased fibrosis or increased inflammatory cells, vascular congestion. Okay, nothing. Spleen, prominent white pulp, hyalinized vessels. Not really sure if that means anything. Increased fatty infiltration, pancreas. I don't care. Kidneys, several globally sclerosed, gloomer or whatever the fuck, tubular autolysis. Yeah, don't care. Adrenal, intracellular, corpuscle, fat, lipid identified. Whatever. Thyroid, follicles of variable diameters, early autolysis. Bone marrow, don't care. Don't fucking care. Radiographs. Let's see what we got. Radiographs of the head and neck identify a radiopaque missile just beneath the occipital skull at midline. Fun shit, dude. Additional minute fragments are seen extending from a front to back trajectory. Fractures of the occipital bones and the base of the skull are noted. The cervical spine and hyoid bone appear intact. Dental restorations are present within the few remaining teeth within the mouth. Radio. So, like, I wonder, this guy, it sounds like he's missing some teeth. Sounds like he's missing some toothus there, man. But it's hard to say, man. They didn't give us a full diet of all the shit they're telling us, man. They didn't talk about the teeth too much. Maybe that's coming up, man. Maybe that's part 4 down here. Radiograph of the chest reveals moderately enlarged cardiac silhouette. Radiographs of the chest, abdomen, and pelvis reveal degenerative changes present in the spine. Radiographs of the chest, abdomen, pelvis, lower extremities, upper extremities reveal no clear evidence of acute skeletal injury. Metallic portions of clothing are visible within some of the radiographs. In addition, a radiopaque casing is visible within some of the radiographs in the head, neck, and chest. Pre-processed radiographs. Metallic portions of clothing are visible within some of the radiographs. Belt buckle, maybe? Is that what they're talking about? I don't know. In addition, a radiopaque casing is visible within some of the radiographs of the head, neck, and chest. Radiopaque casing. What the fuck does that even mean, dude? Let's see. Radiopaque deposit surrounding a contact small caliber. Oh, okay. All right. Yeah. They're talking about the bullet, I'm guessing. In the head, neck, and chest. So he breathed some of that down in him? Did some of that go down into his chest? Huh. Not too sure. That's the powder from the gun blasting through his whole fucking body. That's the only thing I can think of there. Tissue representative sections of all major organs are retained. Toxicology: heart, blood, peripheral blood, vitreous, urine, liver, bile are obtained at autopsy. Results: forensic toxicology analysis is performed and reported separately. Fun times. Let's see. Vitreous screen shows slightly elevated urea nitrogen and creatinine levels. No evidence of hyperglycemia is seen. I wonder what causes that. If that's the whatever that medication was he was on. We'll find out in a minute. Microbiology: bacterial cultures of the blood grew whatever. Fuck, who cares, dude? Bacterial cultures of the right lung show scant growth of which is most likely due to post-mortem overgrowth. Yeah, most likely due to post-mortem overgrowth. Post-mortem overgrowth. Name of a punk band. Post-mortem overgrowth. Yeah, I don't care. Okay, stool cultures. Showed none. Isolate. Yeah, did nothing. Bacterial cultures of the urine show no growth. PCR. They did a PCR test on them. They tested them for coronavirus. This is hilarious. This is the test. Any of you out there curious about the coronavirus, look up the PCR test on Wikipedia. You'll be pretty amazed what it actually says as far as that and the coronavirus. Anyway, PCR, they did a PCR test on this guy, so they could have told if he had coronavirus or not. Influenza and respiratory viral pathogen shows no RNA detected. Film array for us shows no DNA or RNA detected. Urinalysis reflex urinalysis identified turbid urine with trace ketones, protein, blood, bacteria, and epithelial cells. NMS Labs. Let's see, where are these guys? These are in Pennsylvania. Willow Grove, Pennsylvania. Shipped to South Pennsylvania, really? Paddock. Steven. Oh, patient ID. I don't know. Chain. Who cares? Who cares at all about all this? Clark County's coroner's office. Attention, David Mills. I guess. Huh. Okay, so David Mills was the guy doing sending this out and getting the findings back. All right, so here's all this crap. Drink caffeine, but he didn't drink coffee in the room. What the fuck, man? What's up with this guy? That's weird, man. They got good coffee there. Let's see, theobromine. I remember looking this up a while ago. A lot of these didn't really hold much weight. I think there were a couple that actually did, but I don't remember which ones they were. Figured we had people looking at this autopsy pretty hardcore. Didn't realize at the time those people were fucking nuts, but whatever. We're gonna focus on stupid shit like no scars when fucking he had his appendix removed somehow. Disclaimer: specimens for elemental testing should be collected and certified metal-free. Yeah, who cares? I don't give a shit about your bullshit. Cyanide screen, blood, metals, post-mortem, expanded with MPN. Yeah, this is just what they did, I think. Right? Testing requested. Yeah. Specimens received. They got some blood, heart blood, vitreous fluid, urine, bile, liver tissue, brain tissue, muscle tissue, gastric fluid, skeletal muscle. Okay. Let's see. Specimens received 10/10, 2017. Maybe that's why this report took so fucking long. They're sending shit to everybody. But that report up there really didn't have much to do with what's here. So, whatever. Detailed findings. Whatever that acid is, not sure. Arsenic, bismuth. Yeah, well, you can have some arsenic. I mean, you just swallowed a bullet. Mercury, probably going to have some of that because you swallowed a bullet. Selenium, antimony, lead. Yeah, definitely. He had some lead in them. Let's see, caffeine, theobromine, chlorine, whatever the fuck, nordiazepam. I think that's what he was taking, was diazepam. Yeah, whatever. It's all diazepam stuff, I believe. Other than the findings above findings, examination of specimens submitted did not reveal any positive findings of toxicological significance by procedures outlined in the accompanying analysis summary. Reference comment: antimony peripheral blood. Pentavalent antimony compounds are used in medicine as whatever. Additionally, antimony has been used in the production of pigments, alloys, and flame retardants. Typical normal antimony concentrations in the blood are less than 5, micrograms per liter, I believe. Patients administered whatever the fuck that is, sodium, or developed an average peak blood antimony concentration of wow, fuck, dude, that jumps up. Jeez. That escalates really fast at 1.3 hour post intramuscular. Yeah, who cares? NMS Labs has demonstrated that certain collection tubes can artificially increase measured antimony concentrations, rendering reported concentrations difficult to interpret. Okay, so why are they saying the antimony? Okay, antimony 9.6. Yeah, okay. So he had double, but here it says you can have like fucking retarded amount. So who cares? Arsenic, metallic element, is prevalent in the Earth's crust and can therefore be found in numerous environmentally related sources: well, water, shellfish, and soil. Individuals who are exposed to these sources may have acutely or chronically elevated body burdens of arsenic. Arsenic exists in numerous chemical compounds as well as several chemical forms. Not all arsenic compounds are equal in toxicity. In unexposed normal individuals, arsenic concentrations in blood are usually less than 10 micrograms per liter, but may be higher after seafood consumption, which he had. So, what did he have? So, 10 micrograms per liter on arsenic. Yeah, he had 12. He didn't have that much elevated. Um, so, in reported poisoning fatalities range of 600. Yeah, he didn't have that. So, he wasn't poisoned. Uh, ketoacidosis. For anyone saw A Few Good Men, that was an issue. Related to diabetes or alcoholism can be an important factor in determining cause of death. The primary ketone body produced through ketogenesis is uh, acetoacetate, something like that. May then break down to form acetone and beta hydroxybutyric acid. So, ketogenic diets and other uh, means of clinically induced mild ketogenesis have been applied to the treatment of epilepsy, Alzheimer's disease, and other. Holy shit. Ketogenic diets and other means of clinically induced mild ketogenesis have been applied to the treatment. Oh, treatment of epilepsy. I was going to say, cause what the fuck? Are people doing it to cause epilepsy? But no, it doesn't. So let's see. So below 50 below 50. So this is at with the yeah, okay. It's nothing. Non-issue. Bismuth. Um, Bismuth is used industrially to produce low melting alloys, pigments, and chemical additives. It is also used therapeutically as astringents, antacids, skin powders, radio-opaque agents, and to treat ulcers, indigestion, diarrhea, syphilis, and warts. Beautiful. Normal blood concentrations are usually less than 1 microgram per liter. The primary result of bismuth overdosage is renal damage, but encephalopathy and peripheral neuropathy can also occur. Other signs of bismuth toxicity may include discoloration of the tongue, gums, yeah, whatever. Toxic bismuth blood concentrations arising from the chronic oral use of bismuth subnitrate range from 50 to 2 death cases associated bismuth toxicity. Reported bismuth blood concentration in excess of 1,000. So they don't even have really a it sounds like this is fucking crazy rare. Let's see though, bismuth. Oh, 0.92. Yeah, okay. Sounds like it's not an issue. Um, Not an issue at all, actually. Fuck. These guys do good on the bismuth. Caffeine, no dose. Why'd they put no dose here? What the fuck does that mean? Fuck kidding me? Caffeine, yeah, okay. Yeah, whatever. The reported qualitative result is confirmed testing is required. Please contact the laboratory. Um, is usually not toxicology significant. Yeah, who cares? Let's see. What the fuck? Chlor, whatever the fuck. Is a potent antihistamine that has been used alone and in combination with other cold symptom relief medications, both prescribed and sold over the counter. It may be provided by injection or nasal spray. Huh. Oral doses usually range from 4 to 12 milligrams, with both normal and controlled release formation. So, how much of this did he have? Chlor, whatever the fuck. 13. That's not the same measurement. Reported limit is 10. It doesn't even sound like that much. Over. whatever ng milliliter per milliliter. Um, Not sure what the ng stands for. Peak concentrations of were obtained 3 hours following single oral administration of 8 milligrams. Toxic effects have been reported in adults at concentration greater than 400, and in infants concentration. I wonder where this comes from. The blood plasma ratio of is approximately 1.2. Um, Common adverse effects, yeah, sedation, dizziness, nausea, dry mouth, yeah, but he didn't have enough for that. The I don't know, is that his inhaler? Whatever's in his inhaler, but it says cold symptom relief medication. So, is he taking some Nyquil, some shit like that? Lead, lead, environmentally toxic. Oh shit. Yeah, yeah, we all know it's toxic. In young children, lead exposure is a particular hazard because children absorb lead at a higher rate than do adults. And because the developing nervous system of children is more susceptible to the effect of lead, the U.S. Center for Disease Control and Prevention, which we all trust at this point, reference value based on the 97.5th percentile of blood level distribution in the U.S. children is okay. Yeah, I'm sorry, but that's not an issue. I don't think that's an issue. Um, Not even gonna look because they don't even give you a guideline. They give you a guideline for people 1 through 5 years old. So apparently that wasn't much an issue. Let's see, mercury, trace element, which is widely used in industrial and agricultural products and processes, and in medicine and dentistry. Dietary intake of mercury in man ranges from approximately 1 to 30 micrograms per day. Industrial exposure to mercury occurs through inhalation or by dermal absorption. Mercury exposure can be due to elemental, inorganic, or organic forms of the element. Total blood mercury levels up to 5 micrograms per liter have been measured in person with low fish consumption up to 200 milligrams blood in individuals consuming large quantity of. Okay, so I'm actually curious about that. Let's see. So mercury. I'm actually very curious about that because he did eat fish, but I want to know if he ate a lot. Let's see. Mercury, 37 micrograms. Okay, it's 37. Let's go back to mercury. So, person with low fish and up to an individual consuming large quantities of predatory marine fish. Predatory marine fish. Typically, normal mercury blood concentration are less than 10 micrograms per liter. Post-mortem total blood mercury concentration range from 20 to 110, with an average of 60 have been reported in a Japanese population. He ate sushi twice. So, yeah. Nordiazepam. Nordiazepam is a pharmacologically active metabolite of several, benzodiazepine, whatever the fuck, diazepam. Nordiazepam is also a major active entity in clorazepate. Okay. A benzodiazepine agent used for agitation, seizures, and anxiety, which I think anxiety is what we're going for here. The action of this compound is based on its CNS depressant activity. So, yeah, they don't give us a number on what would be fatal. Let's see, oxazine, whatever. It's a benzodiazepine. This is all part of his medication. Um, let's see, signs are observed with other diazepines, e.g., drowsiness, lethargy, respiratory depression, and coma. Man, this shit should have put him down. Should have, you know, hippied him out, but it didn't. Selenium is an essential trace metal. Is also used in various industries, electronic semiconductors and rubber. In medicinal, selenium can be found in shampoos and dietary supplements. Compound exists in elemental, organic, and inorganic forms. Reported reference concentration of selenium in blood of normal ranges. Yeah, whatever. Adverse effects. Selenium cause include irritation of the skin, mucous membranes, nausea, diarrhea, fatigue, alopecia, uh, alopecia, sounds like a name, joint pain, abdominal pain, tremor, yeah, coma and death. Beautiful, beautiful, beautiful stuff. Sounds like a warning after a medication commercial. Hey, 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 how you doing? Trying to get through this, man. Just muscling through. This is horrible. This is terrible. This is just trash. So temazepam is a benzo hypnotic agent used in short-term relief of insomnia. It's a major metabolite. Osban is also a pharmacologically active depressant. Is also a metabolite of diazepam. So this is all diazepam stuff. Alcohol greatly enhances the activity of benzos. Let's see. Theobromine is a whatever the fuck alkaloid found in tea and cocoa products, and has been reported to pass into the breast milk of nursing mothers. Thanks for that information. Theobromine has the general properties of the xanthines, including whatever and smooth muscle stimulation. The reported qualitative result of the substance was based upon a single analysis only of confirmation tests. So, okay, all right, whatever. Sample comments. What does that mean? Sample comments. This ain't a test. Um, unless alternate arrangements are made by you, the remainder of the submitted specimens will be discarded 13 months from the date of this report, and generated data will be discarded 5 years from the date of analysis were performed. Chain of custody documentation has been maintained. Yeah, okay. This is the most exciting part of this report. Man, I thought the timeline was bad. This is horrible. This is just torture. Analysis summary of reporting and reporting limits. That's why I never even paid attention to this part of this report. All of the following tests were performed in this for this case. For each test, the compounds listed were included in the scope. The reporting limit listed for each compound represents the lowest concentration of the compound. Okay, so here we go. Here's the breakdown, I'm guessing. Whatever the acid is. I thought they were going to give us a breakdown, man. What the fuck? Are you kidding me? Says the reported limit listed for each compound represents the lowest concentration of the compound that will be reported as being positive. Okay, all right. So that's what they're saying. Arsenic, bismuth. Okay, so these are, basically he had a lot of other stuff in them, I'm sure, and these are just what they're saying. These are the limits, the lowest they would show, since those were elevated levels. That's why they showed those particular ones in that part of the report. Benzodiazepine confirmation, blood analysis by high performance liquid chromatography. Yeah, this stuff don't mean much to me. I mean, I'm not willing to actually look a lot of this stuff up right now. If I could find someone that dealt with this sort of thing, I'd give it to them and say, figure this out. But most of this doesn't mean anything to me whatsoever. Ethanol. And I think that's just what they tested for. I don't even think any of this is like what he actually had in him. I don't know. But I don't even care. Flight mass. The following is a general list of compound classes included in this screen. The detection of any specific analyte is concentration dependent. Note, not all analytes in each specified compound class are included. Some specified analytes outside these classes are also included. For a detailed list of all analytes and reporting limits, please contact our labs. Yeah, okay. Amphetamines, all that sort of stuff. He had the benzos in them. Can it? No. Yeah, this isn't the actual. These are the limits they would report normally, and he didn't have this stuff. Analysis of gas. Yeah, I don't care. I don't care what your limits are. I mean, I guess, yeah, they They gave this to us. Positive findings: antimony, barium, lead, mercury, barium, bismuth, mercury. Yeah, okay. Whoa, what? All right. Now we're talking. We got some pubic hair up in the system. Yeah, that's something. So they gave him some hair. They gave him some pubes. They gave him some bones. Scalp hair. Let's see. So antimony, barium, lead, mercury. That's where they got all this crap from. Okay. Antimony hair. Barium was in the pubic hair. What have you been rolling around in, bro? What is that about? Got a little barium in your pubes? That's a little crazy. What you been putting on those things? Soap. Most likely soap. I believe that was the one that said soap. Or detergents. Let's see. Sample comments. Unless alternative arrangements made by you. Yeah, don't care. All the following tests were performed. In this case, for each test, the compound listed were included in the scope. Okay, yeah, they tested for all scrap. Don't care. Don't care. Okay, sympathetic. Is the date the same? Where's the date? Yeah, report issued. Last report issued. 12/11. All right. Let's see. So, bismuth, selenium, antimony, caffeine, bromine. Yeah, it's the same stuff. The same thing. They just they did a second test, I'm guessing, and this is what we got going on here. Yeah, this is the second test. They retested them. I don't know why they included both tests, but all right, that's cool. I guess they're being open about it. And in honesty, this is something they've been more open about than anything else. Glucose, lead, mercury, the diazepam stuff, potassium, selenium, sodium, yeah, urea, nitrogen, yeah. Sample comments, yeah, I don't care. Analysis, summary, reporting limits, yeah, it's same stuff. It's all the same stuff. It's all boring stuff. It's just we test for this. This is how much we test for. If it falls below this, we don't care. It doesn't end up on the screening. Let's see the following general list of general compound classes, including and gas. Okay, yeah. So yeah, that's how much ethanol you have to have in your system for this to show up. Let's see, autopsy, brain. Oh Jesus, really? Here, go into the brain now. Comment: the hypertensive changes are consummate with the stated age of the deceased and evidence from general autopsy of hypertensive cardiovascular disease. The extent of formation of corporeal whatever the fuck, as noted in the microscopic description, is known. Incidental findings in the brain of asymptomatic older adults. Man, I bet a lot of people didn't even know what asymptomatic was for this year. In this example, strikingly numerous corporea, amylacia. That's a good name for your kid, man. Anyone look for anyone having a daughter out there? There's no apparent etiology consistent with the lack of any published significance to this abundance of some individuals. Yeah, okay. Stanford. Wow, Stanford. All right. Received through the courtesy of Dr. Gavin of the Clark County Coroner Office and by director transferred for Coroner John Fudenberg on Monday, November 27th. Jesus. And designated with the decedent of name Paddock, tentative, Stephen, as well as an autopsy report identifying paperwork is formalin fixed brain tissue in a sealed plastic container. No DURs received. The prefixation weight of the brain is 1410 grams. My God. When will this end? The written record of the postmortem prosecution of the brain is noted in the received autopsy report. Intraoral gunshot injury is described, in which trajectory included in sequence the roof of the mouth, the base of the skull, the brainstem, cerebellum, left occipital lobe, and partially into the occipital bones. Also described are contusions to the base of the brain and brain swelling. A subdural and subarachnoid hemorrhage, locations unspecified. The cerebral hemispheres were asymmetrical prefixation due to injury. Further quoting the autopsy report, the injured structures at the base of the brain are free of abnormalities. Sections throughout the uninjured cerebral hemispheres reveal no lesions within the cortex, subcortical white matter, or deep parenchyma of either hemisphere. Sections through the uninjured brainstem and cerebellum reveal no lesions. The spinal cord was not removed. Representative portions were retained for formalin fixation. Okay, whatever the fuck that just meant. The fixed brain tissue is received in pieces of varying sizes as follows, with gross abnormalities at present. Uh, Neuroanatomic origins of all portions were substantiated by Dr. Gavin. Photographs were taken for documentation. Frontal lobe, whatever this is, yeah, whatever. Yeah, it took a lot of pictures. I'm kind of over trying to figure out words at this point. Words are hard. Representative sections are submitted as follow: frontal lobe, corpus, yeah, whatever. Um, yeah, so they took a bunch of pictures of the brain. All right, cool. I'm good with that. Uh, how many more pages of garbage is there, man? Jesus, man, what the hell are you guys doing to me? This is horrible. Okay, there's not much left. I want to get through this. I'm so over this final report. All sections are viewed with whatever and whatever and whatever. Fast blue, periodic acid shift. The histological sections of regions designated as injured or containing contused brain are confirmed microscopically. Evidenced by paravascular microhemorrhage. Grossly identifiable subarachnoid hemorrhage is also confirmed microscopically as acute. The pituitary gland shows acute whatever hemorrhage. Yeah, okay. Brain blew up. You blew your brain up. Sections including hemispheric white matter demonstrate high aligned thickening of arterial vessels. Yeah, okay, large subarachnoid. Arterial blood vessels show moderate atherosclerosis. None of the sections show any evidence of either acute or chronic inflammatory reaction within within brain parenchyma, whatever the fuck, providing no support for diagnosis of either an infectious or autoimmune encephalitis or meningitis. Cerebellum is histologically normal, shows no obviously neural loss or reactive changes. The most striking abnormality in sections of the hippocampus. Hippocampus. That was like a prehistoric animal. Parathird ventricular wall, optic nerve, corpus callosum, medial surfaces. Frontal lobes are unusually large numbers of corporea amylacia in subpial, paravascular, and minor. Just English, people, English. It's the fucking language we speak in this country. Uh, Distribution characteristics of the usual age-related accumulation of corporea amylacia in these favored locations. Some of the subpial regions with numerous corporeal whatever display no interface gliosis. The whatever stains highlight the corporea amylacia. No abnormal accumulations of corporea amylacia are found in gray matter as seen in Lafora disease, or except in rare foci. And white matter is seen in the whatever disease, body disease. The following special stains and immunohistochemical stains. Now just making shit up, dude. I'm convinced they're just making words up. Stains were performed with the results described. Um, no evidence of whatever. No. Yeah, all I need is no. Just no. That's fine. No, no, no. No. I'm happy with no. 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 Okay. Nothing there. Some mild increase in perivascular, whatever, without obvious neural loss. Okay. Um, without loss. Okay. No. No. 64-year-old man expired of self-administered intraoral gunshot wound. Love that intraoral gunshot wound. It's like he took. It's almost like he took a bullet. He swallowed a bullet. Um, it's I mean intraoral. That's kind of what that means. You swallowed something. Let's see. No known past medical history. Let's see. Who is this? Haynes Vogel, MD. Okay, whatever. So I think we're coming to the end of this. I have requested that I provide blah blah blah. Yeah, this is the same stuff. Antimony, arsenic. Yeah, whatever. This is all the same stuff. Um, Positive, a bunch of this stuff. Yeah. Okay. Um, let's see. Possibility regarding manifestation of violent, aggressive behavior. Details follows. Okay. Well, I guess this is kind of important. Elemental analysis was performed in blood and hair. Blood is used to determine. I don't care. Um, Selenium, yeah, arsenic. Lead has been linked to cognitive effects. However, for lead at the reported concentration of 7.3 in adults, there is insufficient evidence that this concentration will cause violent and aggressive behavior. Elevated concentration are not known to be associated with product of violent or aggressive behavior. Clinical manifestations of mercury toxicity are dependent upon several variables, such as route of exposure, chemical form, dosage received, and duration of exposure. Some signs and symptoms associated with its toxicity may include bronchial irritation from mercury vapor exposure, gastroenteritis from inorganic mercury exposure. Let's see, and tubular necrosis in the kidney from inorganic mercury. Yeah, okay. But get to the point. Important considerations for this case: the mercury has not been analytically differentiated, and that arsenic, selenium, and mercury concentrations can be elevated as a consequence of dietary consumption, seafood, and or environmental exposures. In samples collected at autopsy from a normal Japanese population, yeah, we read that already. My opinion is that if Mr. Paddock was experienced toxicity of any of the identified elements, he would have experienced a constellation of symptoms specifically related to the element's known toxic profile. Caffeine, yeah, not worried about caffeine. Um, are not consistent with excessive use. Shit, mine are. The reported concentrations in blood is consistent with therapeutic use of whatever this chlorphen, whatever. Asked antihistamine. So is that what the inhaler was? Nordiazepine. The findings of the substance in urine and not in blood show that Mr. Paddock had previously used or was exposed to the drug class. Substances present in the urine do not have any pharmacological activity. What? So he used it in the past, but he hadn't used this recently. That's interesting. Wait, let's read this because that makes sense. That's important. Nordiazepam, osbam, and tamzepam, and benzodiazepines, and ordodiazepam, all the diazepams that he took, or all the PAMs that he took, may be present as a drug and or metabolites. Benzodiazepines are prescribed to treat a wide range of conditions, including but not limited to anxiety, insomnia, agitation. Findings of these substances in urine and not blood show that Mr. Paddock had previously used or was exposed to this drug class. Substances present in the urine. Oof, words breaking out there, boys. Substances present in the urine do not have any pharmacological activity. All right, so yeah, diazepams, he hadn't done them. Hadn't done them recently. He's off his meds. He was off his meds. Holy shit. Oh, okay. Whatever this fucking acid is. It's a ketone body. Let's see. Therefore, the reported concentration of blood is not consistent with the above normal concentration. Wait, this. Okay, I guess this is important. This endogenous substance is used as a biological marker for ketoacidosis. Concentrations less than 50 micrograms per milliliter are considered normal, and therefore the reported concentration of the blood 21 is consistent with the above normal concentration. Yeah, okay. So nothing there. If you have any questions, yeah, I have plenty of questions for you, bro. References, yeah, that's what they did. Oh, did we make it? Oh, we made it. Oh my God, we made it. There's Force Investigation Team. Jerry McDonald. Jerry McDonald. The dude in that HLN thing. Let's see. Joseph Patton, Blake Penny. What is this LEST? Not sure what that is. So there's let's see, Colin. There's one other. Oh, it's Patton. Yeah, Patton was in this report. All right. And then it looks like Trevor Alsop. Yeah, of course he's a sergeant. Jerry McDonald's a sergeant. Yeah, Alsop is just detective. And Eric Lloyd's a lieutenant. Ooh. Is he up here? Yeah, he is. Okay, Eric Lloyd. What about this Stein person? Internal Oversight and Constitutional Policing Bureau, Jamie Professor Captain. Is that her middle name? Wow, that is a crazy name. Jamie Prosser. Oh, Prosser Captain. She's a captain. Okay, she's a captain. But the captain's not up here. Is she? No, captain's not up here. Anyway, who cares? All right, so that's pretty much it for this fun-filled autopsy of Stephen Paddock. And hope you all enjoyed it as much as I did, because that was pretty painful. Anyway, so you had a couple things there. Let's see. We had degenerative spine, which tells you that dude was shrinking, dude. The dude was actually shrinking legit. It's in the report. Why that is a problem, not too sure. Eyes were the same color. The eyes were brown. Same color we see in some of the photos. Well, the few photos that we have of him. Shit, the LVMPD has only been around 73. That's crazy. Yeah, so that's not an issue. Eye color is not an issue. The height is not an issue. This thing debunks the appendix because they say twice in this report that the appendix have been removed. So obviously either the scars healed or they are there and they just decide to not post them. That's pretty fucking simple to figure out. I don't know why there's so much behind that. The only thing that you really have to go on here that is not explained within this, as far as this being Stephen Paddock, is the earlobes. And again, you had all kinds of hemorrhaging, you had all kinds of nasty things happen to this dude's head because, he literally just blew his head up. And so, in that, those ears may not actually be detached. They may be actually folded over. Unless somebody has a better picture than the ones they handed out, there's no way to really tell. So that's, I don't think that's an issue either. In fact, I don't think any of that is an issue. This right here is probably the most open piece of information that we have. This autopsy spans almost a quarter of this report. This is massive. They threw all kinds of stuff in here. They're pretty open about everything. And I'm not too sure where some of these things came from. I always like to look at the origins within people's theories and ideas. The origin of the appendix being removed, I believe, was actually in this report, the same report that does not mark the scars or does not note the scars of the appendix being removed. But this report is actually saying that the appendix have been removed. So to me, that's a non-issue. If that's where you got your information from, they're telling you the appendix are removed. So why do you not believe the appendix are removed on this individual being done here? That makes no sense. Um, as far as the eye color, they're telling you it's brown. Looks brown. Um, corpse on the floor. Really don't care what the color of the eyes are there, man. It's a weird room. It's the lighting's kind of strange, and yeah, those eyes are got a little bit of hemorrhaging going on inside those eyes. Those eyes are doing all kinds of crazy stuff. One's even popping out of his head. So, you know, not too interested really in his eyes. Um, and then, as far as the ear goes, again, you got a lot of swelling. So, people keep asking, do you think this is Paddock? Do you think that the guy that they got up there is Paddock? Well, if the guy in this report is Paddock, then it sounds like that was Paddock. It sounds like it was. I haven't seen anything to the contrary of that. And livor mortis is not a fucking issue. I mean, when you look up livor mortis and it says it is not a standard way because it's in what is it? It's not reliable. It's not a reliable source of time of death. Well, if it's not a reliable source of time of death, then that argument is completely invalid. Because at that point, it's not a reliable source. It's not a reliable source of time of death, according to these professionals. Therefore, where does somebody get off in saying that it is a reliable source of death when, they're really not a professional? So, whoever this person is in this autopsy here, yeah, it's probably the same guy in that room. It's probably the same guy dead on the floor. Is this Stephen Paddock? Prove to me it's not, because I don't know. I mean, willing to listen to arguments, but as of this point, nobody's been able to point out anything at all. So I think that's about it. And I'm going to end this one. This went a little long, but I did want to get through this, man, because this was torture. This was horrible. Anyways, have a good night and happy 4th of July, everybody. Celebrate this shit. A lot of people try and take this away from you. So celebrate the independence of your nation. You should all be proud of your nation. People died for this country. And everybody should be proud to be American, not ashamed of it. If you're ashamed of it, go somewhere else, as far as I'm concerned. You don't fucking need to be here. And yeah, and when someone sacrifices their life for yours, you should fucking be proud of that. Or you should not be proud of that. I guess that's a bad choice of word. But you should at least show some fucking respect. Anyways, stay safe out there. Don't blow any limbs off. And until next time.